Welcome to the CareClinic Pod. I'm Emma, and this is Jones.
You ever feel like you're just slogging through mud?
Yeah.
Even when like everything's sunny and you should be happy?
Yeah.
We all get sad sometimes. That's totally normal.
Yeah.
But how do you know when it's more than just sadness? You know?
That's a really great question. And I think a lot of people have trouble figuring that out. Actually, almost 7% of adults in the US will experience a depressive episode every year.
7%. Wow. That's more than I thought.
It is.
That's a lot of people. And it really makes you think about how important it is to know like what's normal sadness and what's grief and how's that different from like actual clinical depression.
Yeah,
I mean, figuring that out like makes a big difference in getting the right help, right?
it really does.
So I guess that's what we're talking about today.
It is. And if you're feeling kind of overwhelmed or unsure about what you're experiencing, there are a lot of resources out there like the CareClinic app.
Oh, yeah.
But let's start with like just unpacking the definitions of grief and depression.
Okay, yeah, let's do that.
All right. So the American Psychological Association, the APA, they define grief as the really deep sorrow we experience after a significant loss. And that's usually when we think about like death
Yeah.
of a loved one. But it can also be from losing, a pet or a relationship or even a job, just anything that has a special place in your life.
Yeah, grief isn't just about death, it's about loss.
Yeah.
And loss can come in so many different ways.
Exactly. And even though it's a natural process, grief can have a powerful impact on us. It can impact us emotionally, mentally, and even physically. You might experience anxiety or confusion or difficulty sleeping. You might even see a weakened immune system.
Really? I didn't realize grief could affect us in so many ways.
Oh, yeah. Yeah. And, in very serious cases, it can even lead to thoughts of suicide. So if you or anyone you know is experiencing this, please remember that the National Suicide Prevention Lifeline is available at 988.
That's right. There's always help. And no one should have to go through that alone.
No.
Okay. So we talked about grief. Let's talk about depression. How does the APA define that?
Well, they define depression as this intense sadness or despair, and it lasts for more than just a few days. And, it's not just feeling a little down. It actually starts to get in the way of your daily life. You might have trouble with work or social interaction or even taking care of yourself.
So it's not really just the sadness, but it's how long it lasts and how it affects your life.
You got it. Exactly. And just like grief, depression can show up in physical ways, too. You might have changes in your appetite, have trouble sleeping, feel tired all the time, or even have aches and pains that don't have another explanation.
So how are we supposed to tell the difference between grief and depression? There are so many of the same symptoms.
Yeah, it can be really tricky. They both come from experiences of trauma and loss, which makes it hard to tell where one begins and one ends. Actually, there used to be this thing called the bereavement exclusion in the Diagnostic and Statistical Manual of Mental Disorders.
Bereavement exclusion, what is that?
Well, it meant that basically you couldn't be diagnosed with major depressive disorder within 2 months of a loved one's death.
Huh. So they're basically saying that grief could like hide or even be mistaken for depression.
Yeah, precisely. But here's where it gets really interesting. They actually took that exclusion out of the latest edition, the DSM-5-TR, because they realized that grief and depression can happen together and that grief can sometimes actually cause a major depressive episode.
Oh, wow. That really changes things. So how can mental health experts tell them apart now?
Well, now there's a new diagnosis called prolonged grief disorder,
Okay.
or PGD. And you get this diagnosis when intense grief continues for over a year after a loss. And it's so intense that it really affects someone's ability to live their everyday life.
So this new PGD thing recognizes that grief can be really, really hard and that it can last a long time and that it might need to be treated differently than depression. This is all so fascinating.
It is. And, another key difference is how they both actually show up. Grief usually comes in waves triggered by memories or things that remind you of what you lost. But depression is more constant. It's like this heavy weight that's there no matter what you're doing.
Yeah, that's a good way to put it. So someone who's grieving, they might feel okay 1 minute and then be totally overcome with sadness when they like see a picture or hear a song that reminds them of their loss.
Yeah.
But someone with depression just feels sad all the time, no matter what.
Exactly. You're getting it. And there's more. With grief, there's often this longing for the person who's gone, like this desire to see them again. But depression Depression can make you feel the opposite. You lose interest in everything, even in connecting with other people.
Wow. These are like small differences, but they're so important for figuring out what's going on. So I guess what we're saying is, well, both grief and depression are serious and you need help. They might need different kinds of help.
You got it.
Okay. Well, we'll get into those different treatments in just a bit. But first, we've got to take a quick break. Don't go anywhere. We'll be right back. Oh, and if you want to learn more about taking care of your mental health, remember to check out the CareClinic app. It's packed with tons of useful tools and information.
So before we took that break, we were talking about grief and depression and how they can be similar, but maybe need different approaches to healing.
Yeah, and like the biggest thing for me is just knowing they can both be treated. Like you don't have to just suffer and not say anything.
Right.
So let's talk more about how they're treated.
Okay. Well, therapy is often a main part of treating both grief and depression. It gives you a safe place to explore those feelings, learn how to cope, and really work through the challenges. And there are types of therapy that can be particularly helpful.
Like what? What kind of therapies?
Well, there's interpersonal psychotherapy, or IPT. And IPT focuses on like improving your relationships and social connections, because those can really take a hit after a loss or when you're dealing with depression. And it can help you deal with any conflicts that might be adding to your stress and teach you how to build, healthier and more supportive relationships.
So it's not just talking about how you feel, but it's like giving you the tools to deal with problems in your relationships, which could be making your grief or depression worse.
Exactly. And for people who are dealing with prolonged grief disorder, grief-specific cognitive behavioral therapy, or CBT, can be really effective.
Okay, I've heard of CBT, but like, how is it different for grief?
Well, it uses techniques from traditional CBT, like changing negative thoughts and challenging, unhelpful beliefs. But it's specifically designed to address the challenges of grieving.
So it's like it helps you, identify and change those thought patterns that kind of keep you stuck in that grief and despair.
Exactly. And it helps you develop healthy coping skills to manage those really intense emotions and intrusive thoughts that can come with grief.
That sounds really helpful. What about complicated grief therapy? Is that different?
Complicated grief therapy, or CGT, draws on CBT and interpersonal psychotherapy. It often involves revisiting the story of your loss and processing those painful memories in a structured and supportive setting. It also helps you set personal goals and rebuild your life in a way that honors the person you've lost while still, helping you to move forward.
It sounds like with all these different therapies, connection is a really important part of healing, especially when you're dealing with grief or depression. And I bet support groups can be really helpful with that.
Oh, you're absolutely right. Connecting with people who've experienced similar losses can be really, really validating. It reminds you that you're not alone and gives you a safe space to share your story without, worrying about being judged.
Yeah, knowing that other people understand what you're going through can be really comforting and make you feel less alone.
Definitely. Now, apart from therapy, medication can also be helpful in treating both grief and depression.
What kind of medication?
Well, antidepressants are often prescribed, and there are different types like SSRIs, SNRIs, and tricyclic antidepressants. And these work by kind of rebalancing the chemicals in your brain that affect your mood and your emotions. For example, SSRIs, they work by increasing the amount of serotonin in your brain, and serotonin is a neurotransmitter that plays a big role in regulating your mood.
So it's not like medication just like erases the sadness or the grief, but it can make those feelings less intense and maybe make it easier to do therapy or use other coping strategies.
Exactly. It's really important to remember that medication isn't a quick fix and should always be used under the care of a healthcare professional.
Right, of course. It's all about finding the right combination of treatments that works for you.
Yeah.
And I just want to say again that getting professional help is so important. If you're struggling with intense grief or think you might have depression, talking to a doctor or a therapist is the best thing you can do to start healing and recovering.
I couldn't agree more. They can help you figure out what's going on, make a diagnosis, and create a plan just for you.
And there's no shame in asking for help.
Yeah.
To sign a strength and that you're taking care of yourself.
Absolutely. You deserve to feel better and to find ways to cope with your grief or manage your depression so you can live a happy and meaningful life.
Now that we've talked about different treatments, it's important to think about how our world has changed. We live in a digital age with constant information overload, and we're exposed to loss in new ways. Do you think that's affecting how we experience and process grief?
That's a really interesting question, and one that researchers are just starting to look into. Constantly seeing news and social media updates about death, even when it's people we don't know, it could be making us less sensitive to loss, or even making it harder for us to deal with our own grief when it happens. I mean, think about how many times you've been scrolling through your feed and seen a story about a tragedy or a celebrity who's died.
Yeah, it seems like it happens all the time. And it makes me wonder if seeing so much of that stuff makes it hard to deal with our own losses.
It's a valid concern. We're bombarded with images and stories of loss and tragedy, and we don't often have the time or space to really take them in and process them.
And then there's social media, where people only show you the good parts of their lives. Does that make it harder to grieve in an authentic way? Like to really express how we feel online?
That's definitely something to think about. We might feel like we have to look strong and resilient online, even when we're hurting inside.
This is really making me think. It makes you wonder if being constantly connected and seeing these like perfect versions of people's lives is changing our relationship with grief.
It's something we need to keep exploring for sure. And it's not just the digital age. Culture and age play a big part in how we experience and express grief, too.
That's true. Different cultures have their own traditions and rituals for death and grieving.
Mm.
And how old we are can affect how we deal with loss, whether it's a parent, a friend, or even a pet.
Absolutely. It's a complex issue, and there's no one way to understand or manage grief.
It's really amazing how much we've learned about grief and depression today. Like starting with just the basic definitions and the symptoms and then realizing how hard it can be to tell them apart.
Yeah. And we've talked about how important it is to get professional help, whether that's through therapy or medication or both. And we've also talked about how helpful support groups can be, connecting with people who really get what you're going through.
Those connections are so important. They remind us that we're not alone, right?
Exactly, exactly. If there's one thing I really hope our listeners take away from this, it's that you don't have to go through this alone. Reaching out for help is a sign of strength. It's the first step to healing and recovering.
And remember, there are like a lot of resources out there, like the CareClinic app. It's got so much information on managing your mental health, coping with grief, and finding support.
It really is a great resource.
Yeah.
So as we wrap up today, I want to leave you with this thought. How can we as individuals and as a society create a more supportive and understanding environment for people who are grieving or struggling with depression?
That's a big question, but an important one. It's like, how can we get rid of the stigma around mental health and create spaces where people feel safe to talk about how they feel and ask for help without feeling judged?
Yeah, it's about having empathy and compassion. Being willing to listen to someone without giving advice or trying to fix things. Sometimes just being there and acknowledging someone's pain can be the best support you can give.
Yeah, just being there for someone can make all the difference. And it's important to remember that recovery is possible. It's not a destination, it's a journey. And it might not be easy, but with the right support and self-care, you can heal and grow and build a better future for yourself.
Well said. Thank you for joining us for this episode of the CareClinic podcast. We hope you found it informative and encouraging.
And remember, you're not alone. Take care.